When taking a person's blood pressure, there are a few pre-assessment protocols to follow. First, you want to be sure the person has been resting with feet flat on the floor with a back support and arm resting at heart level for at least 5 minutes. You also want to be sure blood pressure measurement is taken on the left arm, which should be bare. Therefore, if the person has sleeves or a jacket, instruct the person to remove jacket or lift sleeves. Also instruct person not to intake caffeine or nicotine at least 30 minutes prior to assessment. Proper cuff size must be used to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. Second, when placing the cuff, you want to align artery mark with brachial artery. Ensure stethoscope, ear prongs face forward, place bellows stethoscope over brachial artery. Third, you want to be sure to turn valve to the right. Inflate to 180 millimeters mercury or 20 millimeters mercury above first Korsakoff sound. Next, you want to turn valve to the left to release at a rate of 2 to 5 millimeters mercury per second. Systolic blood pressure is a point at which you hear the first strong Korsakoff sound, and diastolic blood pressure is the first point before the disappearance of Korsakoff sound. Fourth, person should be allowed to wait 3 to 5 minutes before blood pressure is reassessed. The normal blood pressure range is a systolic value less than 120 and a diastolic value less than 80. Pre-hypertension is 120 to 139 for systolic and 80 to 89 for diastolic. High blood pressure, stage 1, would be considered 140 to 159 for systolic and 90 to 99 for diastolic. High blood pressure, stage 2, for systolic would be 160 or higher, diastolic 100 or higher. Hypertensive crisis, systolic would be higher than 180, diastolic higher than 110. After assessing each group member's blood pressure, we observed normal range values for 4 out of 5 of the tested subjects. Subject 2, however, tested in a pre-hypertensive classification.